Hello, everyone. I know you see a frozen screen because we were waiting for tape playback, and it's starting now. Great to see you again.
Nice to see you, Kim.
President?
Very nice to see you.
How you doing?
How are you?
President?
Hello, everybody. Hey, sit down, please. Well, thank you all for being here. Mr. Secretary, formerly Mr. Governor.
Energy
Nice
Week,
to see
sir.
you. How's it going? Everything good?
Yes, sir.
That's great. Thank you all for being here. Very much appreciated. We welcome you to the White House. Have you all been to the White House before? Have you been here before?
Yes.
That's good. Well, you guys have been. Most people say no. I'm very impressed with that, Kim. I'm thrilled to be joined by Governor Paul LePage, Kim Reynolds, Pete Ricketts, and Bill Walker, along with state and tribal leaders from around our great country. I'd also like to thank Secretary Perry and EPA Administrator Pruitt, both here also, for their work to help the United States achieve true energy dominance, and that's what's happening. We've made so much progress with respect to energy just in the last 4 months. It's been an incredible journey, I will tell you. We've learned a lot and we've made a lot. We're here to talk about how we can create new prosperity for our citizens by unlocking vast treasures of energy reserves, of which we have a great deal, far more than anyone understood. I'm proud to have such a large gathering of tribal leaders here at the White House. I look forward to more government-to-government consultations with tribal leaders about the issues important to Indian country. We love Indian country, right?
Thank you.
Many of your lands have rich natural resources that stand to benefit your people immensely. These untapped resources of wealth can help you build new schools, fix roads, improve your communities, and create jobs like you've never seen before. All you want is the freedom to use them, and that's been the problem. It's been very difficult, hasn't it? It'll be a lot easier now under the Trump administration. For too long, the federal government has put up restrictions and regulations that put this energy wealth out of reach. It's just totally out of reach. It's been really restricted. The development itself has been restricted, and vast amounts of deposits of coal and other resources have been taken out of your hands, and we're going to have that changed. We're going to put it back in your hands. These infringements on tribal sovereignty are deeply unfair to Native Americans and Native American communities who are being denied access to the energy and wealth that they have on their own lands. Many of our states have also been denied access to the abundant energy resources on their lands that could bring greater wealth to the people and benefit to our whole nation. We're becoming more and more energy dominant. I don't want to be energy free. We want to be energy dominant in terms of the world. From my first day in office, we've taken swift action to lift the crushing restrictions on American energy. Scott Pruitt has done an amazing job, an incredible job in a very short period of time, and most people love him. There are a couple that don't, but that's okay, right? We're also putting our people back to work by doing this. Today's conversation is a chance for these state, local, and tribal leaders to discuss how we can cooperate and support them even more in unleashing these domestic energy reserves. They're tremendous reserves that we never appreciated, we never understood, but now we understand them very well. I'm confident that working together we can usher in a golden age of American energy dominance and the extraordinary financial and security benefits that it brings to our citizens, not only the Native Americans, but all over the country. And we're seeing it more and more, and it's happening more and more. I just also want to tell you that yesterday we had a tremendous meeting. The Republican senators met on health care, and the meeting went really well. We're talking about a great, great form of health care. Obamacare is dying. It's essentially dead. If you don't give it the subsidy, it would die within 24 hours. It's been a headache for everybody. It's been a nightmare for many. And we are looking at a health care that would be a fantastic tribute to our country, a health care that will take care of people finally for the right reasons and also at the right cost. Be a tremendous reduction in cost from what Obamacare is. Yesterday in Alaska, a great state, they had it was announced a 216% increase. So we have a plan that if we get it approved, it's very tough. Every state is different, every senator is different, but I have to tell you, the Republican senators had a really impressive meeting yesterday at the White House. We had close to 50 of them. We have 52. We need almost all of them. That's never easy. But we had essentially 50 show up to the meeting, and the other 2 are on our side. I think we're going to get at least very close, and I think we're going to get it over the line. There was a great, great feeling in that room yesterday. And what also came out is the fact that this health care would be so good, would be far better than Obamacare, and would be much less expensive for the people, and actually much less expensive also for the country. So those are a lot of good factors. So we'll see what happens. We're working very hard. We've given ourselves a little bit more time to make it perfect. That's what we want to do. I think this has a chance to be a great health care at a reasonable cost. People can save a lot of money. We get rid of the mandates. We get rid of so much. Got rid of a lot of the taxes. All of the bad parts of Obamacare are gone. Essentially, it's a repeal and replace. And I look forward to working with the Republican senators over a short period of time. I know Rick is very excited about the health care that we're talking about.
Actually, having these governors sitting around the table is a great example of it. And one of the things that I know Kim and Paul, they'd like to be able to put health care into place that they helped write and their citizens helped write, because I know these, I don't know Bill that well, but my bet is he's the same. You give him the authority to take care of their citizens, they can have more people do it at less cost. I'm quite confident.
Well, we're sending a lot of it back to the states where it belongs, and this will be something really special if we can get it done. Always tough. It's probably the toughest subject from the standpoint of approval, because every state is different. Every state has different needs. We have a tremendous opioid problem, and some states are more affected by that than others. But overall, I have to tell you, this will be a tremendous plan. It will really, you're going to have a lot of very, very happy people in this country if we can get it done. So we're working very hard on health care, and I think we're going to have a great answer, and hopefully we're going to have it soon. And we will keep you informed. Thank you all very much. Thank you. Thank you.
Mr. President, are you concerned about the Medicaid cuts in the health care bill?
It's going to be great. It's going to be great. This will be great for
Why
everybody.
are you saying if? Do you think I hope that this will get across the finish?
I always say it. I always say it.
Mr. President, yesterday Governor Baker said he doesn't know if you still believe in climate change, if you think it's a hoax. You gonna ever answer that?
Thank you all very much. Thank you. Thank you.
Mr. President, are you prepared to take any actual steps against Amazon, sir?
Thanks, Press. Thank you.
President Trump meeting with local, state, and tribal leaders at this meeting at the White House.
Let me see if there's a speaker.
This was tape playback, so we are going to cut away from this now that we've watched it all. We're going to take you live to this press conference that's about to start. Senators talking health care. Stay tuned.
Nice to see you again. Fernando Stein from the American Academy of Pediatrics. Yes, hi. Hi, Jack Eddie, American College of Physicians and Internal Medicine. Excellent. Well, thank you for being here. I guess Senator Hassan and I are speaking, and you're speaking on behalf of the group? Yes. Yeah. Are you out of time? Tight time? No, are you okay? I think I'm good. Okay, well, let's bring everyone up. This is an impressive group. Yeah. Good afternoon. I feel healthier with all of these experts here today, and we're very grateful for your dedication and all of the people that you represent. And I want to thank Senator Maggie Hassan, who is here with me as well, a passionate advocate on health care, and we're very pleased that we have so many people that are with us. Dr. Fernando Stein will be speaking in a moment, the president of the American Academy of Pediatrics. But let me also just introduce Dr. Michael Munger with the American Academy of Family Physicians from Kansas, and Dr. Jack Endave, American College of Physicians from Pennsylvania, Dr. Hayward Brown, American College of Obstetricians and Gynecologists from North Carolina, Dr. Renee Bender, American Psychiatric Association from California, and Dr. Boyd Boozer, American Osteopathic Association from Kentucky. Did I miss anyone? Great. Well, as I said, we are extremely pleased to have people with us, and even though yesterday we had some temporary good news, we know that the Senate majority is still focused on passing a bill that will raise costs for all Americans, that will lower the health care coverage and medical care for many tens of millions of people. And the great insult of this whole debate is that the savings being used will be giving a tax cut for wealthiest few Americans, which does not represent real American values, certainly in my judgment. So, thank you. Yes. Thank you. And I also want to say in starting that the Senate Republican majority began the day after we were sworn in on January 4th to undercut, repeal the current health care system. And they originally anticipated, they said they were going to do this by January 27th. It is well past January 27th. And the reason this has not happened is because of leadership of the physicians and hospitals and nurses and activists, people who advocate for cancer patients and Alzheimer's patients and our children, the disability community, working with all of us in the Senate and the House to say no. And so far, the reason we are where we are and there is not a vote today, as they had anticipated, is because people across the country know that this is personal. Healthcare debate is not political. It may be being addressed as a political exercise. We all know in our hearts and souls this is not about politics. This is about people. It's about our families. This is personal. And so yesterday, the Senate Democrats stood on the Capitol steps and showed pictures. We have we have some behind us, many that we held up. I want to mention Amy from Royal Oak, Michigan, right here, small business owner who has leukemia. She has a $20,000 a month medication bill. Very quickly hit her out-of-pocket costs because of the Affordable Care Act. She is able to get her medicine, is able to get the care that she needs, and of course, as someone with a pre-existing condition, is terrified about what will happen along with the ability for her to get her treatment. And we have stories that we held up on the Capitol steps, and we know that these are the people that we are fighting for. Under what's being called Trump Care, this would really take us back to the days when the insurance companies were in charge instead of the doctors that are with us now. Your number of cancer treatments would not be determined by your doctor. It would be determined by the insurance company. And we know what happened when, in the past, prior to patient protections, someone could get sick, and then get dropped from their insurance or have very limited ability to get the care that they need. We also know at that time, while you could get a cheap policy, and Republican colleagues talk about the fact that people have a right not to have these burdensome rules like the requirement to have maternity care or the requirement to actually cover something, that prior to that time when insurance companies actually had to cover something and doctors were the ones making decisions, you could get a very cheap policy. I called those junk policies, and as long as you never needed it, it was great. But if you got sick, my office would get a call saying, what do you mean they'll only cover 1 day in the hospital? What do you mean I can't get what I need? So those were not the good old days. Those were the days when people were not covered and didn't get the help they needed. So this essential health care benefits that we've said, the basics for people under health insurance, which Republican colleagues again call burdensome regulations, basically say prescription drug medications to treat and prevent illnesses should be covered, maternity care so that being a woman, it does not amount to a pre-existing condition. If you want to have a baby, mental health and addiction services, even hospitalization and a trip to the emergency room. There's basics that you should know are covered if you are purchasing insurance. Without this, we know people will pay thousands more out of pocket, and we will actually see less care. And finally, before turning this over to my wonderful colleague, Senator Maggie Hassan, let me stress the fact that what they are doing to Medicaid health care, first of all, has nothing to do with the private market. They debate whether or not costs are too high in the private market. There are costs too high. Count us in. Prescription drug prices too high. Count us in on fixing that. There are people with out-of-pocket costs that are too high. We want to focus on that. None of that relates to Medicaid, where states are actually saving money by people getting out of the emergency room for things that could be done in the doctor's office. Michigan's going to put $432 million more into the state budget this year because uncompensated care in the emergency room is down by 50%, meaning people aren't walking in without insurance to be able to pay for the bill. And we celebrate that 97% of the children in Michigan can now see a doctor. So doing the right thing is actually saving money. What our colleagues, unfortunately, are doing is wanting to take those funds to pay for a tax cut. So if we want to talk about real ways to improve health care, count us in. You want to take away people's health care to pay for a tax cut, which for the top 400 people amounts to $33 billion collectively? Count us out. And that's really what the fight is about. Again, this is personal. This is not about politics. We are greatly appreciative of the people that are with us today and all those that they represent. Senator Maggie Hassan.
Well, thank you to Senator Debbie Stabenow, who is a terrific voice for her constituents in Michigan and just been a terrific leader on this issue. I also want to thank all of the advocates and the various physician groups who are represented up here today. You're all on the front lines, and you're doing critical work as we continue to debate the future of our nation's healthcare system. And I'm reminded with all of you here, I'm the granddaughter of a pediatrician and my mother, growing up in the 30s and 40s in his household, remembered that starting at about 7 o'clock in the morning, he would, as he shaved and got breakfast, move the phone from room to room and plug it into a different phone jack because the calls would start coming in. And she just remembers all the advice given to usually mothers of children who had the stomach bug overnight. And the advice always ended with no butter on the toast. And it is a reminder, too, though, of a simpler time in medicine, and a reminder that we have much to celebrate in the developments that our medical community, our research community have brought us, the lives that are saved, the quality of life that so many people today have, even though they have chronic illness and disability. It's also a reminder of what is at stake. I want to just also start with pointing out two photos here, because there are two Granite Staters here. Carla in the red jacket and Bodie in this wheelchair. We heard from Bodie's mom at our emergency field hearing on Friday in New Hampshire. Senator Shaheen and I had an emergency field hearing. The reason Bodie, age 3, has that phenomenal wheelchair is because of the Affordable Care Act, because when her insurance company told her that it didn't need to pay for a wheelchair, she knew that the Affordable Care Act had said that was not the case. And so she called back and she advocated, and Bodie, you should see him handle that amazing wheelchair. Carla's story is about the importance of Planned Parenthood, and I just don't want people to forget that the Trump Care bill that is still being considered would defund Planned Parenthood. And because of care that Carla got from Planned Parenthood when she was 19 years old and a college student without the funds to afford health care, the debilitating pain that she had that was caused by ovarian cysts that would have caused her to drop out of school, that was treated, and she got better. And she not only went through college, she clearly has a family now. So that is the power of access to health care. There's a reason you see so many physicians here from so many different specialties. These doctors know firsthand that Trump Care is really bad for America's health. Yesterday, after trying to push through dangerous legislation that would be a disaster for the people of New Hampshire and millions of Americans, Republican leaders decided to delay the vote on Trump Care. It was and is the loud and passionate voices of Americans speaking up, calling their senators, and describing how Trump Care would impact their lives. That's the reason why we're not voting on the bill this week. But make no mistake, Trump Care is not dead yet. The decision to delay the Senate vote does not change the fact that under Trump Care, Americans would pay more for worse health care coverage, all in order to give billions of dollars in tax breaks to corporate special interests, including Big Pharma, at the expense of hardworking Americans and the programs they rely on. This is the basic principle of Trump Care, and it is unacceptable. The various versions we've seen of Trump Care would make things worse for most Americans, whether you currently get your insurance through your employer, whether you buy it individually, or whether you have Medicaid. If you buy your own insurance, you could have to pay more for your coverage. Trump Care establishes an age tax, which would be especially harmful if you are between the ages of 50 and 64. Trump Care would allow states to get rid of the requirement that they must cover important patient protections. These essential health benefits, ones Senator Stabenow talked about, include maternity care, prescription drug coverage, and coverage for substance use disorder services. Trump Care also ends Medicaid expansion, which in New Hampshire has provided 50,000 hardworking Granite Staters with quality, affordable health coverage in a bipartisan Medicaid expansion plan. And experts have said our bipartisan Medicaid expansion is the #1 tool they have to combat the heroin, fentanyl, and opioid crisis in my state. In addition to ending Medicaid expansion, Trump Care would cut and cap the Medicaid program, which forces states to choose between slashing benefits, reducing the number of people who can get care, or both. That would impact children, pregnant women, seniors who need home care or nursing home care, and people with disabilities. And Trump Care would continue Republican efforts to roll back access to critical health services by defunding Planned Parenthood. We know the Affordable Care Act isn't perfect, but Trump Care is not the answer. It's time for Republicans to come to the table in order to improve the current law, build on the progress we've made, and lower health care costs for all of our citizens. I'm willing to work with any of my colleagues on bipartisan solutions in order to make that happen. While my Republican colleagues have delayed a vote on this bill, this fight is far from over. And I'll keep working to ensure that Trump Care never becomes law. I urge you all to keep up your efforts. Please do not stop opposing this bill. People have to keep calling, sharing their stories, making your voices heard, and your priorities heard as well. You know, Bodie's mother told us on Friday that he was about a year old when he got his diagnosis for a particular and rare kind of muscle degeneration. And she was with her husband in the hospital as they were getting the news. Her husband isn't from the United States. He's from, I think she said, Nepal. And he held her hand and said, you know what? This is tough, but at least we're in America. He'll get health care. That's what this is about. We're a democracy where everybody counts, and we can make sure that everybody gets health care. Thank you.
Thank you.
And Dr. Stein.
Yes, Dr. Fernando Stein, American Academy of Pediatrics. So it's Mr. President.
Thank you.
That's a nice ring.
Yeah. Thank you, Senators. Good afternoon. I am a pediatrician from Houston, Texas. I've been practicing pediatrics there for the past 40 years, and particularly in the field of critical care.
All right, everyone, we are recording this press conference. We'll go back to it a little bit later on, but it looks like senators are talking about Trump care on the Senate floor.
Has never had health insurance in her life until the passage of the Affordable Care Act. Now she qualifies for Medicaid, and thank goodness she does, because she's been diagnosed with diabetes, and she needs a doctor she can count on and good medical advice. So when we say that we were passing the Affordable Care Act so that more people would have access to health insurance, it's happened. And we also said we're going to change the health insurance policies you buy so that you don't get tricked into buying something that is going to provide protection but only enough and not enough when you really need it. For example, there used to be lifetime limits. People would buy health insurance and say, I'm going to keep the premium low, I'll sign up for a lifetime limit. How could I ever need health insurance for more than $100,000 a year? Well, it's an eye-opener, but there are many diagnoses or accidents that could happen to you next week that'll cost more than $100,000. And a lot of people found themselves facing personal bankruptcy because they had a limit on their health insurance policy and just faced a cancer diagnosis and knew that they'd have to spend $150,000 or $200,000 for the most basic care. We also said that you can't discriminate against people when you sell health insurance because of a pre-existing condition. Well, it turned out insurance companies defined pre-existing condition to include everything. Acne when you were a teenager, asthma, you name it. In fact, they went so far as to say that being a woman was a pre-existing condition. Some of those things made no sense, and we said, that's over. We're not going to let that happen anymore. 1 out of 3 Americans has a pre-existing condition. You can't discriminate against a person because they're in a family with a child who's survived diabetes or is living with diabetes, or a spouse who survived a cancer surgery. So we said from now on, under the Affordable Care Act, when you buy a health insurance policy, it's going to cover the basics. We did something else, which I want to mention because I don't want it overlooked. There used to be a senator back here in the second row, or the last row, second seat, Paul Wellstone of Minnesota. Paul Wellstone was a great guy. You couldn't help but love him, whatever your politics. And over here was Pete Domenici. And he was a conservative Republican senator from New Mexico. Wellstone of Minnesota, Domenici of New Mexico. What would those two have in common? What they had in common is each of them had someone in their family with a mental illness. And they watched what happened to that loved one in their family. And the two of them teamed up and said, you know what? From this point forward, when you buy health insurance in America, it's not just going to be physical health that it's going to cover, it's going to be mental health. Because so many families are touched by mental illness, some very serious forms, some not so serious, but need medical help. They all should be covered. And so they put that provision in the Affordable Care Act. So now when you buy a health insurance policy in America, it's not hit or miss. It covers mental illness, as it should. Then they added a provision which most of us didn't pay attention to, and we should, and we do now, mental illness and substance abuse treatment. Think of this opioid and heroin epidemic and the people who are dying right and left. Think of the families who are just absolutely consumed by the addiction of a child, a teenager, wondering if they can get them into treatment so that they can save their lives. For many of them, that health insurance plan is paying for that treatment that otherwise would come out of their pocket if they could afford it. So we put all these things into the law, and the law took place, and when the Republicans said they're going to repeal it, people stood up and said, wait a minute, I have to face lifetime limits again? I have to face pre-existing condition prejudice again? I'm not going to have mental illness covered automatically or maternity care covered automatically? Well, when people reflected on this, they realized our vulnerability. So simple repeal was not enough. The Republicans needed to replace. If they were going to eliminate Obamacare and all the people protected by it, they needed to replace. And that's when the process fell apart. In the House of Representatives, they went through a process of writing the replacement. And when it was all over, they didn't wait for the Congressional Budget Office to analyze it because they knew what was coming. The Congressional Budget Office announced that some 23 or 24 million Americans would lose their health insurance by the plan that passed the House of Representatives. They also knew that people could face again discrimination based on pre-existing conditions. They knew that basic health insurance didn't include the protections that all of us really need to count on. Remember the provision in the Affordable Care Act that said that your son or daughter could stay on your family health insurance plan till you reach the age of 26? Pretty valuable, isn't it? That son or daughter that you like a lot and helped get through college was doing internships and looking for a job. You wanted to make sure they had health insurance, didn't you? Well, that was part of the Affordable Care Act. And the guarantee we want to make sure remains in any future change in the law, too. The House of Representatives passed their measure, and unfortunately, it was a partisan roll call. Only Republicans voted for it. It passed by 4 votes. If 2 Republican congressmen had changed their votes, it would not have passed. Then the measure came over to the Senate, as you remember from your civics lesson, and the Senate had its chance. So what happened? We had a chance to take this question to the committees of the United States Senate, Labor and Health and Education Committee, which is chaired by Senator Lamar Alexander, a friend of mine, Republican of Tennessee, ranking member, Senator Patty Murray of Washington. We had a chance to take the bill to the committee and to debate a better approach in the Senate, to have public hearings and witnesses, but we didn't do that. Instead, the Republican majority said, we're going to do this on our own. We don't need any Democratic input. 13 Republican senators will meet in a room and write the alternative to the House health care replacement bill. And they did. And it went on for weeks, and no one saw it. There were no reports of what it included, what was inside of it. And then 6 days ago, it was announced. 6 days. And we took a look at it, and it wasn't that much different than what the House had done. The Congressional Budget Office released a report Monday of this week and said 22 million Americans will lose their health insurance under the Republican health care plan. 22 million. And this part was really troubling. There would be a dramatic increase in premium costs for people between the ages of 50 and 64. Some of them would see increases of up to $8,400 a year in premium costs because of the Senate Republican plan. So what was the reaction of the medical professionals across my state to both the House Republican plan and the Senate Republican plan? It was the same reaction. They said, Senator, vote against it. The Illinois Hospital Association said that if we cut back in Medicaid, hospitals, particularly rural hospitals and downstate hospitals, will have to cut back in services and may face closure. The doctors in my state, the Illinois Medical Society, came forward and said, vote against the Senate Republican plan and the House Republican plan because we know what happens when people lose health insurance. They still get sick. They don't come and see us early on where we can prevent things from getting worse. They come see us when things are pretty bad and pretty expensive and pretty dangerous. So the doctors opposed it, the nurses opposed it, the pediatricians opposed it. Not one single medical advocacy group in Illinois supported the Senate Republican bill that was unveiled 6 days ago. And when it came to pre-existing conditions, it wasn't just the medical groups that opposed the Senate Republican bill. The Cancer Society, the Heart Association, the Lung Association, most of the major disease groups stepped up and said the pre-existing condition provisions in this bill are unacceptable. And sadly, the policies that are going to be sold may not cover the basics that people absolutely need. And then the other thing came out. What drove this whole debate, what started health care reform in the House and in the Senate, was not health care reform, but a tax cut. You see, the Affordable Care Act imposed new taxes, particularly on higher income individuals. And the money from those taxes went into sponsoring people into Medicaid, helping people pay their health insurance premiums. So the Republicans in both the House and the Senate said the first thing we'll do is to cut those taxes, about $700 billion worth of taxes. Ultimately, they took out $1.1 trillion out of our health care system with this tax cut and other cuts. And when you pull that kind of money out of health care in America, fewer people have health insurance, fewer people have a helping hand when it comes to paying their premiums. Well, the reaction to the Senate Republican bill over the last 6 years has been growing opposition. Growing opposition until yesterday, Senator McConnell announced, we're not going to vote on it this week. We were supposed to, but we're not going to vote on it this week. He said that he may return to it when we come back from the July 4th recess. Well, here's the point that I wanted to make on the floor today. I'm glad that we've reached this point, that these proposals by the House and the Senate are not going to move forward quickly and become the law of the land. Too many people would be hurt, too many innocent people, too many families would lose their health insurance. The cost of health insurance would go up dramatically. The premiums would go up, particularly for people over the age of 50. And we'd see hospitals facing closure across our state. We'd see cutbacks in treatment for mental illness and substance abuse treatment. The list goes on and on. It would have been a terrible outcome. And certainly doing this in order to give a tax cut to the wealthy people in this country makes no sense. Incidentally, how much is the tax cut? If your annual income is $1 million a year, under the Republican plan, your tax cut is over $50,000 a year. Well, the people who are wealthy aren't asking me for that tax cut, and the people who will suffer because of it are folks that aren't making anywhere near $1 million a year. Here's what we need to acknowledge. The current health care system in America needs to be improved. There are things in the Affordable Care Act which need to be addressed, and we need to do it in an honest fashion. And we need to do it on a bipartisan basis. I've talked to some Republican senators since Senator McConnell has pulled this bill back, and they want to sit down and talk. Senator McConnell said there'll be no conversations with Democrats. Republicans will do it by themselves. I hope over the 4th of July he reflects on that, because there are Democratic senators who in good faith want to sit down and make a better health care system for America, so that more people have the peace of mind and security of health insurance, and so that it's more affordable for families all across the board. The biggest, toughest part of health care today is the so-called individual health insurance market. 5 or 6% of people who need to buy health insurance plans, they don't have it where they work, they don't qualify for Medicaid. Those are the ones that are seeing the premium spike. Can't we take the collective wisdom of the senators, Democrats and Republicans, and sit down and address that problem effectively? Of course we can. But we need to have a starting point. So my plea to the Republican leadership is to listen carefully, as our Democratic leader Chuck Schumer said yesterday. Once you take repeal off the table, once you take this massive tax cut for the wealthy off the table, we are ready to pull up a chair and sit down at that table. Wouldn't it be a breath of fresh air in America in this day and age, in light of all that's going on, if Democrats and Republicans worked constructively together to make the health care system better, more affordable, stronger for families and businesses across our nation? I think that's why we were sent here. I think that's the reason we're supposed to be here. And I sincerely hope that happens next. So we're ending the debate in the Senate this week, but we're not ending the debate in America. I urge those who think this is an important issue, and I'm one of them, to speak up and to go home. I'm going home soon, and to meet with people and have a conversation about where we go next as a nation. We can solve this problem, and I know we can do it in a constructive way. And if we show that kind of bipartisan leadership in the Senate, I think the House will join us. I think they'll do the same thing. I think they can have a bipartisan approach too. What a relief it would be with all of the breakdown in comedy, all of the breakdown in communications politically, the warring camps that have become the American political scene, if we could show why there is a Senate and why there is a House and why people run for these offices. It's to solve problems, not to put out a press release, not to stake out a political position, but to solve a problem. This is a problem that needs solving. I hope over the next week that both parties will reflect on it. When we return after the 4th of July recess, we can roll up our sleeves and go to work. Mr. President, I yield the floor and suggest the absence of a quorum.
Clerk will call the roll.
Mr. Alexander.
All right, for those of you just joining us, you are looking at a live look at the Senate floor. Looks like we're switching to the shot outside the White House.
We just come out of a meeting with the president on energy. I'm the governor of Maine, Paul LePage, and I will tell you, it was so refreshing to have a president that's willing to talk to us about the specific needs and differences of the different states and wanting to help each individual state with their needs. And we are all different, and we all have different needs, and it was just absolutely a wonderful day. And I mean, it's just a new beginning here in this country. And if he continues with what he did today, he will make America great again. Thank you.
As the governor of Alaska, I am honored to be able to be at the White House and hear a discussion about energy dominance. We're an energy-rich state. Much has happened and not happened in our state. This is a great day for Alaska for energy dominance. We have an oil pipeline that's 3/4 empty because of lack of access to where the oil is. We inject gas in volumes greater than most countries use in an entire day. So it's a great opportunity. I have to say the president was very, very engaged on energy dominance, and that is music to our ears in Alaska. And I have to say Secretary of Interior Zinke has been very engaged as well. He's been to Alaska since his confirmation, and we're very, very pleased with his role in this. So we have hope that on energy dominance, we have an opportunity to actually have a product that we can export that will bring the balance of trade down significantly. So this is a good day for Alaska. I'm very, very honored to represent Alaska here today at the White House.
Good afternoon. I'm Kim Reynolds, Governor of Iowa, and I too want to reiterate how appreciative we are of this White House and the Cabinet. The accessibility to the Cabinet and to the President is unprecedented, and as the Governor stated, each of our states are different, and it's important that we have a diversified portfolio so that we can do everything we can to keep our energy costs low, so we continue to grow the economy and provides jobs. I had the opportunity to talk about renewable energy. It's an important factor in Iowa, whether it's ethanol, biodiesel, biogas, and wind, and the importance of really a diversified portfolio and how that has allowed us to have some of the lowest industrial electric rates in the nation, and we're proud to be able to offer that, and it's economic growth for rural Iowa, and I appreciated the opportunity to highlight and the engagement that we continue to see with this president. Thank you.
Hi, I'm Pete Ricketts. I'm the governor of Nebraska, and I'd certainly like to reiterate what my colleagues here said with regard to this administration and their willingness to seek out us as governors and ask our opinion. It's important because policy that's made here in Washington, D.C. does not get implemented in some generic place called the United States. It gets implemented in our states, and we're the ones that's impacted by it. And I really appreciate the president and his administration working with us as states to seek our input about how to implement federal policy and really work with us as partners. And that is just a night and day difference between this administration and the last administration. When it comes to energy, we were talking as a Nebraska, we are an ag state, and we were also talking about biofuels. In fact, something a lot of people may not know is Nebraska actually produces about 1.5% of all the fuel that goes into your cars through ethanol. And so we're punching way above our weight when it comes to how we help out on energy security here in the United States. One of the other projects we talked about is a fantastic project we've got going on in Nebraska with a company called Monolith Materials that will build the first carbon black factory in Nebraska that's been built in this country in the last 25 years. They've got a unique process to be able to crack natural gas into carbon black and hydrogen. And we're also going to be using that with our public utilities. We're the only public utility state left in the country to build the first utility scale hydrogen burning plant in the country. Now, why is that important? Well, as Governor Reynolds mentioned, we want to make sure we have a diverse portfolio of energy, but also the emission from burning hydrogen is water vapor. It's completely clean burning. So again, by being innovative and allowing for these types of projects in our state, we're not only helping for our energy independence, but also looking for innovative ways to make sure we continue to treat the environment in a way that will allow us to pass on our great state to the next generation. We also talked about the Keystone Pipeline as well, and that policy, and again, that will be the safest pipeline that's been built to date, and again, helping us with energy independence here in this country. So again, we're all very excited to be here today, to be asked to the White House to talk about energy policy. We're very grateful for the opportunity to meet with the President and look forward to taking your questions.
Governor Reynolds, can you talk about what you heard for Iowa, what you really think Iowa's future will look like when it comes to the energy?
Well, I was able to highlight, as I indicated, our diverse portfolio and how important that was. We can take biomass and not only do ethanol and biodiesel, but also biochemical products and now biogas, and the importance of really providing predictability from the administration, whether it's the renewable fuel standard, so that we can provide that stability so we can continue to see an investment into the various renewable energy. We talked about the percentage of coal, but the percentage of wind that's generated in Iowa. 36% of our electricity is generated from wind. Ethanol and biodiesel contributes about $2 billion annually to the state's economy. And so we just talked about the importance of continuing to drive that, to continuing to look for opportunity for research and development so we can add value to our natural resources. And it's an agriculture state that's extremely important to our farmers. And it really means economic development and growth in rural Iowa. And we want all of Iowa to be successful and growing. And so I appreciated the opportunity to highlight that. And again, I've met with Administrator Pruitt on several different occasions to talk about the RFS and the importance of maintaining that and really standing true to the congressional intent of the legislation. You know, we talked about an all of the above energy policy, and that's what's important. And so he wants to continue to build a diverse portfolio, and that's what's important. So we're an ag state, and it's important for us to take advantage of the renewable industry that we have in Iowa. And so we're going to continue to provide an all of above. I appreciate the opportunity for his willingness to really get things done, to get past the regulatory process, and just to get it done attitude, I think, is really important. And that's what's really exciting, I think, as leaders of the state. Instead of being held hostage, we actually have a partner that is working with us to get things done, and that's really important.
Governor LePage, we also heard the president talk about health care in there. Senator Collins from your states raised concerns about the cuts to Medicaid in this Senate health care bill. Do you share those concerns?
No, and today we're here about energy, and I met with Senator Collins this morning, and I think Senator Collins is going to be being briefed on what the state really believes in health care.
Do you think she'll vote for this bill in the end?
I have no idea. I don't read her mind.
Would you vote for the bill?
No. No, because it doesn't go far enough to fix it. I'm on the conservative side of this bill, and I think we're going to work together to make it better.
Thank you, Press.
Great. Thank you very much, folks. Appreciate it.
All right, everyone. So that was live feed from outside the White House. This is the point of view of our stakeout camera outside the White House. Various state, local, and tribal leaders meeting with President Trump earlier today to talk energy. President Trump also touched upon health care during his meeting with these leaders. We'll continue with more News Now coverage in just a moment. Looks like we now have just our typical bump shot of the White House. Don't worry, we'll have more News Now. Stay with us. More to watch in just a moment. Earlier today, officials in New York held a press conference following their investigation into an explosion that took place at Central Park months ago. We're going to go ahead and show you guys that press conference now.
Just lay it across, okay? No, all right.
Just watch his rig, man. It's kind of teetering.
I know. That's why I don't want the microphone on it. Thank you for coming.
We get to start all over. There you go.
All right. All right. You got a clip on there? Okay.
Yeah.
I can just try to. go on the side if you want down here. Whatever. All right.
Just throw it on the floor.
Is that all right? Yeah. Okay, just let me know when you get the sound and everything when you're up. You roll? You roll? Okay. It's like, guys. Are you going to find a spot there somehow? Sneak in there or whatever? We got people in the back there, Bob? We got one of our guys back there? I knew that plane was coming, so I decided we wait. Just, you know, this is science here. All right, how are we doing? Oh, you're good? Everybody up? Oh, hold on. You're not going to be able to.
Lavalier mic?
No. Oh, yeah, I did.
Gotta go back to the truck.
No. All right. No, not. We're just going to stick with this because we really got other. Just get ready.
I got Central Park. It's a good backdrop. Yeah.
Next time I'm pooling this. All right. How are you going to get in there? Just there?
Yeah.
Where's that mic going to go?
Right here.
You're going to pick up all right?
Yeah.
All right, okay. Tell the union guys it's not my fault.
Deputy Commissioner what?
All right, and
there you go.
Slide in.
Yeah.
No, you like that. That's good.
All right, okay.
Sorry.
All right, get it. Whoa, easy with this. I'll tell you what we do. That's the best as it gets, right?
Yeah.
All right.
Is that your phone mic?
All right.
I swear we're going to start soon.
We're not getting it.
All right, we got to roll. Just don't pull, knock over the top. Yeah. Okay. All right. Going once, going twice. All right, that's it. Mike, don't worry about that. All right.
I'm going to get it anyway.
All right, folks. All right, heads up, all right? Thanks.
Yep. Who said we're not gentlemen?
Good morning, everyone. My name is Chief Robert Boyce. I'm the Chief of Detectives from the NYPD. To my left and to your right is Special Agent in Charge of Sean Benedict of the ATF, and of course John Miller, Deputy Commissioner of the NYPD, as well as case agents behind me. We are here nearly on the 1-year anniversary of an explosion in Central Park, severely injuring a young man, a 19-year-old young man. To this date, we have an active and vigorous investigation. We're attempting to ascertain who left this homemade explosive device, at this location. Right now, we're still missing a lot of answers. We need a lot of information, so we're reaching out to the public. So this young man, Connor Golden, it'll be 1 year Monday, came here to slackline off this rock directly behind me, at which time he had jumped down and stepped on a plastic bag filled with an explosive device, a mixture of compounds, severely injuring his leg. He was taken to the hospital, at Bellevue Hospital, where he remained several days. His leg was amputated up to the kneecap because of that, and right now we're continuing this investigation. We're reaching out to the public. We're coordinating with the ATF, looking a nationwide search for any other kind of explosive device. I will tell you this, it was an explosive device by itself. We're trying to find out exactly when it was there. We think it was there over several days. It was placed there. We don't know why at this point. So we're reaching out to the public, and we have a lot of information, more that has to be answered yet. So that's why we're here at this news conference here today, to seek the public's help and anything they can tell us what's going on with this. Sean?
Thank you, Chief. Specifically, we're calling on visitors to Central Park who may have taken photographs or video of the rock formation behind us in the days and weeks before July 3rd, 2016, to provide them to ATF and NYPD investigators to assist us in narrowing the timeline for when the explosive material was placed here, as well as help us identify potential suspects.
All right, everyone, we're going to cut out of this and take you to the Senate floor. Chuck Schumer is speaking now.
Republican health care bill. We Democrats take no solace in that fact. Unfortunately, the majority seems intent on continuing their efforts to pass this health care bill. Over the next few days and weeks, I expect to see buyouts and bailouts, backroom deals and kickbacks to individual senators to try and buy their vote. What I don't expect to see yet is a dramatic rethink of the core of the Republican health care bill. But I'm hopeful we can get to that point. So far, every single version of the Republican Trump care bill in the House and the Senate has the same basic core to it. The details have changed a bit around the edges, but the core remains the same in each and every version. Slash Medicaid to the bone in order to give a massive tax break to a very small number of wealthy Americans. Cut support for Americans in nursing homes, those suffering from opioid addiction, and those with a pre-existing condition to pay for a tax break for the wealthiest few. The basic premise of every Republican health care bill so far is to cut back on health care for Americans who need it most in order to give a tax break for the people who need it least. There's just no moral calculus to justify it. It doesn't fix any of the problems in our current health care system, like high premiums, high deductibles, counties where there are not enough insurance options. And it's not what the American people are for. The American people are not for tax breaks to the wealthiest of Americans, nor are they for cutting Medicaid. A USA Today poll this morning showed only 12% of Americans support this bill. At a level of 12%, even huge numbers of Trump supporters are opposed to this bill. The level of popular support is not going to change one bit with a tweak that wins over this senator or that. A bill with this twisted idea at its core will fail time and time again. That's why the vote had to be pulled yesterday. You can be sure if it were popular with the American people, it wouldn't have had to be pulled. So, I'd make my friends on the Republican side and President Trump an offer. Let's turn over a new leaf. Let's start over. Let's abandon more tax breaks for the rich. Let's abandon cuts to Medicaid and discuss what the American people are really concerned about. Premiums, deductibles, the cost and quality of health care. President Obama invited both parties, Democrats and Republicans, to Blair House to discuss health care reform in front of the American people early in his first term as president. President Trump, I challenge you to invite us, all 100 of us, Republican and Democrat, to Blair House to discuss a new bipartisan way forward on health care in front of all the American people. It would focus about what you, Mr. President, have talked about in your campaign: lower costs, better health care, covering everybody, not on tax cuts for the rich, not on slashing Medicaid. President Trump, you said you wouldn't cut Medicaid. We don't want to either. We Democrats are genuinely interested in finding a place where our two parties can come together on health care. We want to bring down premiums, too. We want to bring down deductibles, too. We want to stabilize the marketplace. We want to control the outrageous costs of prescription drugs, another thing the president talked about in his campaign. There is plenty of common ground for us to come together around. We believe our health care system has made important progress over the past 8 years, but it still needs to be improved in many ways. We admit the Affordable Care Act isn't perfect. There are ways we can improve on that law and on our entire health care system. So let's talk together about how we can achieve that in a bipartisan way. If my Republican friends abandon cuts to Medicaid, highly unpopular with the American people, abandon tax breaks for the wealthiest few, highly unpopular with the American people, we Democrats are more than willing to meet with them in the White House to talk about how to improve health care for the American people, how to lower deductibles, how to provide better health care for more people at a lower cost. Because that's who we Democrats are fighting for, the average American family, not the wealthy few. Today, we can turn over a new leaf and discuss health care legislation the way our founders intended our government to discuss legislation, as a true debate between all of our country's representatives. Now, yesterday, the majority leader reminded Republican senators that if they failed on their partisan health care bill, they'd have to negotiate with me, the minority leader, and by implication, our Democratic colleagues. When did the prospect of bipartisanship become a cudgel instead of an opportunity? When did bipartisanship become a threat? That's not how Congress is supposed to work. Negotiation with the minority to seek a compromise should be the first option, not the last resort. Let's start over and get back to legislating in a way deserving of the grand tradition of the Senate as the world's greatest deliberative body. Providing for affordable and quality health care is an issue we should grapple with, all of us together. It is one of the most important things we can do for our country. We can do it, but only if we do it together and put the partisan ideology aside. So I challenge the President, invite us all to Blair House. Let's see what we can come up with. Let's try. We Democrats have on several occasions sent letters to our Republican colleagues asking for bipartisan talks on health care. So far, we've been rebuffed. Now, with the demise of this bill yesterday, its inability to get enough votes to proceed, we have an opportunity to go back to the drawing board. We are willing to debate and compromise on health care, but we have to be included. And it has to be a discussion on how to actually improve our health care system for the American people, not slash Medicaid to pay for tax cuts for the wealthy. We can meet and we can try. Or the Republicans can stick to the same partisan approach on health care, which so hurts working families and so benefits millionaires. President Trump, my Republican friends, the choice is yours. Thank you. I yield the floor.
The senator from Indiana.
Mr. President, for all of the discussion about delays, politics, the process, vote counts, budget scores, and analysis, it's critical we remember that this health care debate is first and foremost about people, our friends and neighbors, and their families. It's about moms and dads, sons and daughters, sisters and brothers, grandmas and grandpas. We all agree everyone needs access to quality, affordable health care. Regardless of how healthy you are today, everyone needs the peace of mind that if you get sick, you'll be able to get the care you need. We all know someone who has fought cancer or diabetes or multiple sclerosis or has a child battling a chronic condition or disease. In our shared experiences and relationships, our shared values. Each of us wants our loved ones to be healthy and to live long, full, happy lives. We want what is in the best interests of our families and our friends and our neighbors. I've seen these values firsthand through the stories of Hoosiers who recently wrote to me out of desperate concern about the Senate health care bill. I've heard from everyone, from working parents to students to seniors, that access to quality and affordable health care is critical to their ability to raise a healthy family, to contribute to our communities, and to live our final years in dignity. Take Connor. Connor's a lawyer, and Sarah, a nurse practitioner, and their family in Fort Wayne as an example. In 2015, Sarah was diagnosed with multiple sclerosis, an autoimmune disease that attacks the nerves in her brain and spinal cord. As Connor wrote me, like everyone else who suffers from MS, my wife didn't make this choice. She didn't choose to have MS. Sometimes people get sick. Sometimes people are diagnosed with chronic conditions through no fault of their own. If untreated, she would become severely disabled and her condition would get progressively worse. The best possible outcome for Sarah is controlling the disease and limiting the spread of the symptoms, because there currently is not any cure. Connor and Sarah worry that under the Senate health care proposal, they'd be subject to annual and lifetime caps, making Sarah's treatment unaffordable. Through the Senate health care bill, states could seek waivers that would allow them to get rid of essential health benefits and implement annual and lifetime caps, even for health insurance plans that people receive through their work, just like Sarah does. For Connor and Sarah and others that suffer from conditions like MS, the reforms that prohibit limits on coverage allow them to have the peace of mind that they can live full lives despite their disease and their diagnosis. It's stories like Sarah's and Connor's that remind us why this is such an important debate. It's inherently personal. It's about the health, the well-being, and it's even about the life and death of our loved ones. It's about not going to the ER just to visit a doctor. It's about financial security. It's about financial security so our families aren't one illness or one sickness away from bankruptcy. Take, for example, Beth and Brad from Plainfield, Indiana. They're the proud parents of Kyle. Kyle has special needs, and he relies on Medicaid, not only for his health care, but literally to help keep the family together. Beth recently wrote me, Kyle's on a home and community-based Medicaid waiver. It's not mandated. If Medicaid is cut, Kyle and others like him are in real danger of losing coverage for home nursing and nutrition, among many other things. Without home nursing, Brad or I will also have to quit working. And without enough income to pay for it ourselves, we'll be placed in the horrible situation of either not being able to give our child what he needs at home or institutionalizing our little boy. We want to care for our son at home. We want to work and pay for his primary insurance. That reduces the amount of Medicaid money needed. We want the independence, the freedom, and the responsibility that the minimal supports through Medicaid allow. And Lori from Kokomo, Indiana, wrote to me about her 3-year-old daughter, Savannah. Savannah has a long list of medical issues. She's had 2 open heart surgeries, 8 heart catheterizations, 1 pacemaker placement, and countless other procedures. Her medical bills at 3 years old, she's 3 years old, are in the millions. And she still needs more cardiac surgery in the future. Her annual care, just her meds, her appointments with specialists, therapies, are more than our annual income, despite my husband working 3 jobs. The Senate GOP bill puts her life in grave danger. Lifetime limits and waiving of essential health benefits means she'll lose her private insurance. Allowing alteration or waiver of essential health benefits is catastrophic for Savannah and others with pre-existing or chronic conditions. I'll be forced to look at my child and say, "I'm sorry, honey, Mom and Dad just don't have enough money for your surgery." As a dad, the health and well-being of my family is on my mind every day. And I know that every mom and dad across our country feels the same way. My faith teaches me that we are all God's children. And every man, woman, and child should have a shot at being able to live up to their God-given potential. We'll move heaven and earth to take care of our kids. These values are shared across Indiana and across our entire beloved country. My faith also teaches me that we all deserve to live with dignity. Claudia from Muncie wrote to me, "I'm 55 years old, medically retired flight paramedic and RN. My career was cut short when I was diagnosed with ALS, also known as Lou Gehrig's disease, in 2005. Without Medicaid and the waiver, I would be institutionalized. Because of the things Medicaid covers, I'm still able to be a mom. For 2 decades, I was the person who came to the aid of others. Please, don't fail me or my family now. This bill would fail Claudia and millions of others. It would force Claudia's family and families across the country to pay more, not less, or to even put critical health care out of reach. You don't have to take my word for it, though. The American Heart Association calls this bill heartless. The Catholic Health Association says the bill is devastating. The American Academy of Pediatrics says it fails children. The American Cancer Society says the bill could greatly harm millions of cancer patients, survivors, and those at risk of the disease. AARP, the American Medical Association, the American Hospital Association, and Catholic Charities oppose this bill. Here in the Senate, we've been hired by the people we represent to continue the proud American tradition of leaving our children a country that's even better than when it was given to us. We owe it to the people we serve to ensure they have health care that's affordable and accessible. Ohio's Governor, John Kasich, recently said, when he talked about the challenges with our health care system, that this will never, ever be solved with a one-party approach. He is right. In order to strengthen our health care system, we'd be a lot better served by working together with a bipartisan effort and with input from those who provide health care every single day. The doctors, the nurses, the hospitals, in urban communities, in rural communities, all across our country. And most importantly, we need to remember the patients and the caregivers who rely on our healthcare system. We can do this together. And a big dose of Hoosier common sense would be a huge part of it. Thank you, Mr. Speaker, or Mr. President.
Mr. President.
Senator from Michigan.
Mr. President, I have always believed that elected officials should do more listening than talking. The breadth of issues that we address here in the United States Senate is vast and diverse as our nation. We rely on input from experts, from stakeholders, and constituents to craft responsible, meaningful policy. In the past month alone, I've had the opportunity to attend bipartisan hearings on cybersecurity, countering violent extremism, self-driving cars, rural broadband, nuclear defense policy, and the posture of our armed forces, just to name a few. These issues are vital to our economy and our national security, and they are worthy of the time and effort that went into convening these very important hearings. But over the same time span, the United States Senate did not hold a single hearing on health care while a handful of Republican members drafted a flawed health care bill behind closed doors. Health care policy is unique. It is very complex while also being deeply personal. Throughout our lives, doctors and nurses are with us for some of our most significant moments. Whether it is responding to trauma in an emergency, helping us live with chronic conditions, devising treatment plans for an ailing parent, or delivering a newborn child. Our medical professionals are there for us when we are at our most vulnerable. And we are all vulnerable. Life does not discriminate. Anyone can get in a car accident and need months of physical therapy. Anyone can be diagnosed with cancer and require surgery and radiation or chemotherapy. Anyone can have a son or daughter born with cystic fibrosis. But in this great country, I believe no one should ever go bankrupt because they get sick. And no one should ever die because they cannot afford quality health insurance. No matter, I believe that health care policy is very complex, and we have to work very hard at it. But I'm also guided by a very simple moral concept, that no matter who you are and no matter where you live in this country, no citizen should ever be forced into bankruptcy because they are sick. And no one should ever die because they can't afford quality insurance. And I urge my colleagues to use the coming days to think about their goals for health care in our nation and be guided by their own moral conscience. Passing a politically expedient proposal that can get 51 Republican votes after significant arm twisting so that the Senate can move on to tax reform is not in the best interest of the American people, and I believe it is simply irresponsible. I believe that we should provide the best care possible to as many Americans as possible while making sure that it is affordable. Now, I honestly can't say whether my Republican colleagues share these goals, but I can say that the Senate health care bill that we saw this week does not hit the mark. I urge my colleagues to use the coming days to really think about what this bill will mean for the families in their state. I feel fortunate that Michiganders have been willing to share their heartfelt stories with me in recent years. They are fearful that repealing the Affordable Care Act will not only put themselves in jeopardy, but also their friends and family and neighbors. I've heard from Amy from Metro Detroit. She's 53 years old and has type 1 diabetes, also known as juvenile diabetes. Amy is a self-employed small business owner, and before the Affordable Care Act, insurance companies viewed her diabetes diagnosis as a pre-existing condition and were able to charge her more because of it. After the Affordable Care Act was implemented, Amy was able to shop around and find a much more affordable plan with the same level of benefits that she had before. While Amy does not qualify for subsidies to help purchase insurance, she was still able to cut her health care cost in half in half because of the Affordable Care Act. Amy fears, and rightfully so, that if the Republican health care bill passes, her cost may skyrocket, jeopardizing her business and everything that she has worked her entire life for. I've heard from Tammy, who lives in Marne, Michigan, and Tammy's daughter, Erin, is 10 years old. Erin was diagnosed with cystic fibrosis at 18 months. She takes 23 pills and does 2 hours of breathing treatments each and every day. But she's a fighter, and her whole family has pulled together to support her, but they are also very worried about her future. Erin's family has private insurance, but they supplement the high cost of her care through Medicaid. Tammy is afraid that the $800 billion cut to Medicaid will jeopardize their ability to afford Erin's care and would cast an absolutely devastating blow to their family. And finally, take Stephanie from Livonia, Michigan. Stephanie worked her entire adult life in customer service industry, primarily in retail and at restaurants. She never was ever offered health insurance by her previous employers, and until the Affordable Care Act, she never had health insurance as an adult. And then in December of 2015, Stephanie's third-floor apartment caught fire, and she was left to make a horrific decision about whether to jump from her third-floor apartment or die inside the burning building. Well, Stephanie jumped from the window to save her life, and she sustained serious injuries, including a broken back and a shattered foot. Because of the Affordable Care Act, she was able to receive treatment for her injuries, which included a month's stay in the hospital, multiple surgeries, and absolutely excruciating physical therapy to finally heal in the end. Stephanie's treatment came in close to $700,000, an amount that would surely bankrupt nearly any American. These stories and many more are what health insurance is truly about for people like Stephanie and Amy and Erin. We should do more listening than talking. We should listen to Stephanie and Amy and Erin, and we should listen to the hundreds of healthcare experts that have expressed their strong opposition to this bill and the impact that it'll have on the healthcare system in this country. Mr. President, I would urge my colleagues to listen to the AARP, the American Academy of Pediatrics, the American Diabetes Association, the American Hospital Association, the American Heart Association, the American Medical Association, the Children's Hospital Association, the National Alliance on Mental Illness, the National Breast Cancer Coalition, and the National Council on Aging, just to name a few. And I'm not just hearing from these national groups. I'm also hearing from local healthcare professionals all across my state. Hospitals and community clinics in Michigan, particularly the ones in the rural areas, are telling me this bill could cause them to close their doors. This will jeopardize access to care in communities that are already medically underserved. Costs will go up for seniors and individuals with pre-existing conditions like Amy. No one chooses to get sick, but when we are confronting a disease or injury, health insurance is a lifeline. It allows us to get better, to get back on our feet, and it simply allows us to keep living. In American society, healthcare coverage is our promise that if you work hard and you play by the rules, you will have the healthcare you need when you need it the most. As I've already said, no one in this great country should be forced into bankruptcy because they are sick. And no one should ever die because they can't afford quality insurance. The Republican health care bill is irresponsible. This bill would strip away health insurance from 22 million Americans. This bill would put more and more Americans at risk of financial ruin from unpaid medical bills. And it would put more Americans at risk of dying because they can't afford the care that they so desperately need. Mr. President, this bill cannot and should not be salvaged with minor tweaks and arm twisting to win a few votes. I urge my colleagues to go back to the drawing board and begin an open, bipartisan process where we all listen to our constituents, hold hearings with experts, and work together to keep what works and to fix what doesn't. Let's let common sense rule the day and not partisan ideology. We should do what is best for our folks back home and ensure that everyone has access to quality, affordable health care. Michiganders and all Americans deserve nothing less. Mr. President, I yield the floor, and I would suggest the absence of a quorum.
Clerk will call the roll.
Mr. Alexander.
Mr. President.
The senator from Wyoming.
Mr. President, I ask unanimous consent that the quorum call be vitiated.
Without objection.
Mr. President, I come to the floor today as the pain of Obamacare around the country continues to worsen. The health care crisis continues to grow. Obamacare is collapsing basically more and more every day. People in every state of this union have seen their health care costs skyrocket, happening everywhere around the country. We must do something to help the American people who are suffering under the heavy weight that Obamacare has placed on their lives. I was at a hospital this past weekend in Casper, Wyoming, my hometown, and I talked with doctors, talked with nurses, talked with patients. What I hear at home in Wyoming is that there is an urgent need to do something about the high costs and the limited choices under the Obama health care law. We're having discussions right now about the very best way to do that, Mr. President. Whatever we come up with, it's going to be a fundamental change in a direction away from Obamacare. That's what America wants. It's what America needs. It's what the American people are asking us to do. One of the biggest steps that we need to take is to get rid of the Obamacare mandates and penalties. I hear about it day in and day out, heard about it in my office yesterday for a woman who was in town to visit on another matter, but talked about her experience with the Obamacare situation where her premiums have gone way up, the deductibles are up so high that even though they're counted under Obamacare as having insurance, her husband would tell you that he will not go to a doctor because with a $6,500 deductible, he feels he cannot afford to. But he's counted with Obamacare. He wants more choices, he wants more control of his own life, and he wants to eliminate the taxes and the mandates. Look. Mr. President, I'm sure you hear this at home. People hate the fact that there's a mandate that said they have to buy insurance that Washington says they have to buy, that the Democrats have said they have to buy, rather than what might work for them and their family to be cheaper and work better for them and be more tailored to their family needs. Now, there are more than 19 million people across the country who have decided that they're either going to pay a penalty to the IRS or they've received a waiver so they didn't have to get Obamacare insurance. Either pay the penalty or get a waiver. These are people who made the fundamental decision that Obamacare insurance was not a good deal for them. Now, the second thing we need to do, I believe, is repeal the burdensome and expensive Obamacare taxes. Health care costs have been soaring under Obamacare. One of the reasons is because the health care law added almost $1 trillion of additional taxes onto the backs of hardworking Americans. And these are the taxes that specifically raise the cost of people needing health insurance and health care. They put taxes on things needed by people who are in need of medical care, somebody that needs a pacemaker, someone needs a walker, a wheelchair, an artificial joint. Additional taxes on all of these users of medical devices, medical supplies, of over-the-counter pain medicines, over-the-counter medicine for the fever, sore throat, over-the-counter, as well as prescription medications. The taxes are on just about everything. And, of course, the tax on health insurance itself. So if you buy health insurance, you have to pay a tax on that. Well, what's that going to do to the cost of health insurance? Going to raise the cost for people that have health insurance. When the Democrats were debating and voting in support of the Obamacare health care law on this floor of the United States Senate, they conveniently failed to mention all of these new taxes to the American people. A third important thing that Republicans are committed to doing is to just give much more flexibility to the states when it comes to making and developing health care solutions for the future. I served 5 years in the Wyoming State Senate. We always felt that we could do a lot better job if we just had a little more local control, a little less in terms of government mandates, and make that same amount of money work that much better and go that much further and take care of that many more people. Medicaid is the prime example. I had a state legislator in from Wyoming today in the office. We're talking about Medicaid and what role the states play, what role the federal government plays, how to make dollars go farther at home. Obamacare increased the amount of money that Washington sends to states that chose to expand their Medicaid programs. Now, of course, that's taxpayer money, And then Obamacare paid a bonus to states that said, not focus on the area where Medicaid was intended originally to be focused, which was on poor women, children, and the disabled. They didn't get a bonus, not at all. No bonus money to help those people. The bonus money went to help able-bodied working-age adults. That's not who Medicaid was set up to help in the first place. And I just say, why should Washington collect money from people at home and then send it back out to the states with all these new Washington mandates and restrictions on how the money is spent? Like, I have much more confidence, Mr. President, on the people at my home state of Wyoming, the people of your home state of Arkansas, than I do on any bureaucrat in Washington, D.C. When it comes to developing good ideas about improving America's health care, I always believe the more flexibility and local control and patient control, working with doctors, communities, working with state legislators, the better. We need more flexibility in every state. We don't need Washington telling all of us what to do. Mr. President, if we give people and states more options, there will be more affordable options for insurance as well as for care. Now, Democrats tried their goal, one-size-fits-all Washington-mandated approach. That's what Obamacare was all about, and it did not work. I want to talk about one other thing, Mr. President, that Republicans are committed to doing with our health care reform plan. That's stabilizing health insurance markets while other reforms take effect. You know, the Obamacare exchanges are completely falling apart. Week after week, there is another story, another headline about the disaster that is Obamacare. We're looking at a headline in the Chicago paper, another Obamacare rate shock. Another and shock with rates. That's what people are seeing around the country. Last week, we learned that another 77,000 people in Indiana will lose their Obamacare plan. 2 more insurance companies are leaving the market there. Across the country, there are more than 40 counties where no one is selling Obamacare insurance next year. No one. Premiums have already doubled because of Obamacare in the last 4 years. Next year, people's rates may go up another 40%, 50%, well above that in other places. Cannot allow this to continue. The American people cannot afford it. It is not good for our country. It is not good for the people living in this country. Mr. President, we need to make sure that we help support people who do need help paying their premiums. We need to give insurance companies more flexibility to offer the kinds of plans that people actually want to buy. We need to give states the ability to support their markets in ways that make sense for people in that state. Mr. President, the discussion draft of our plan includes ideas that help keep the individual market going in a much stronger way than under Obamacare today. It stabilizes the markets. The insurance company Anthem put out a statement on Monday. The company said that these kinds of ideas, it said, quote, will markedly improve the stability of the individual market and moderate premium increases. Anthem has been dropping out of exchanges across the country because the markets are unsustainable under Obamacare. Well, that's got to be one of our goals as we continue to discuss legislation. Stabilizing the markets, reducing premiums. There are a lot of good ideas and ways to do it. We're committed to exploring those ideas, Mr. President, and putting together a plan that will help give people the care they need from a doctor they choose at lower costs. That's what the American people want us to do. That's what we're working on. Now, there are limits, as you know, Mr. President, under the Senate rules that keep us from doing some things that we would all like to do. Democrats are ready to work with us, be part of the conversation. I think we can do some things to make this bill even better. But the situation we have today in this country for health care is not working. Obamacare has collapsed. Health care is in a state of crisis. Those who supported Obamacare and voted for it have caused it. We're just trying to clean up the mess. Thank you, Mr. President. I yield the floor.
Senator from New Hampshire.
Mr. President, after weeks of secrecy, after no engagement with the public, after an effort to prevent not only Democrats in this body, but women in this body from participating in putting together a new health care bill. Last week, we saw Senate Republican leaders put forward their bill to repeal the Affordable Care Act. Like its companion bill in the House, this legislation imposes draconian cuts to Medicaid, our nation's principal program for insuring children, to people with disabilities, and to seniors in nursing homes. It drives up costs for middle and low-income Americans while delivering huge new tax cuts to the wealthiest in this country. I start with the premise that you can't take health insurance away from 22 million Americans and call it reform or better care. I think President Trump was accurate when he described this approach simply as mean. The fact is that this legislation is a direct threat to the health and well-being of millions of Americans, including tens of thousands in New Hampshire. The opioid epidemic in the country and in
They took off. They took off right after us. That person cannot be in good shape. Sliding a backboard in there now.
All right, everyone, we're just looking at the LA Fire Department handling a severe collision in the San Fernando Valley right now. Some breaking news there out of Southern California.
Okay, they're getting a different gurney out. No, they pulled one back. That was weird. It's like they're changing it out. I would record the extrication. So there's a backboard, and then they're laying the victim down. Look at those cutters on the left. That's gnarly. Those tools. Those are all hydraulically powered. All right. There he is. That's it. Only one patient in that car. Otherwise, they'd be feverishly trying to. I wonder if there was such a large turnout because firefighter needs help, firefighter down. Hey. Okay. I can do it off from up here. Because I just had Pat record this. Yeah. Self-contained. I'll do it live and then we'll show video. Now, what do you know? What RA was involved? Can you get a specific on that? Because we're having a hard time. 7. So was it the pumper truck? But Rescue 7 is not a transport LAFD vehicle. Yep, Rescue 98 is legit. There's Rescue 98 on the corner. But the only thing that I hesitate is that they're using that as part of the extrication. You could see the chains hooked to the vehicle to try to separate the metal there. We thought so. That's what I thought too, but then we looked closer. I don't know. All right. I don't know if we can maybe make a call and just confirm, Dave, so I can speak. I mean, the LAFD heavy-duty tows here, so maybe that'll be the giveaway. All right, yeah, we're good. Okay. Trying to make it easier for everybody. I mean, at first glance, the right. Okay. Yeah. Yeah, you're right. You're right. It is right there on the right. But then they just used it as part of the rescue operation. Okay, so a paramedic was injured, and obviously the individual that was being transported from a different location already injured. So insult to injury. The extrication. Okay. And what time did this happen at? Okay. All right. Okay. Hey, Greg. Okay. I mean, whatever you want, Greg. I mean, again, I can do it self-contained. We're diligent about recording it on board, so. Okay. Okay. All right. So we'll do it. If we're here and everything's good, then we'll just stay self-contained up here and do it. Thank you. Okay. Yep. Sounds good. No worries. Yeah, they want us to stay here a half an hour, so. Yeah, no, we're fine. We can go wherever you want. I mean, just not as long as we're back here before noon.
Address the issues affecting this bill. I think that as you look at the bill and the report, you will see that it reflects your input. In fact, more than 2,700 member requests were submitted this year, and each of those
Origins and USD, I'm happy that we still have jurisdiction over CFTC and our subcommittee. Representing the Agriculture District, I'm very much aware of CFTC's continued relevance to our farmers and ranchers as well as other industries who use financial instruments to hedge their risk. Turning to your budget, I want to thank you for submitting a budget request that, based on our previous discussions, is based on what is needed to perform the important CFT mission and strays away from legacy areas that may be unnecessary in today's environment. At $281.5 million, it's below the average of requests from 2011 through 2017, which were about $303 million. But it's still a healthy increase over the $250 million that the agency has received for the past 3 years. But it's still, when you look at, though, the historical scope and the exigencies in the financial world, the year 2008 was devastating for our country. Let me just briefly note the damage that was done. We lost about 8.5 million jobs. The unemployment rate increased from 4.7% to 10.1% in October 2009. 10 million families lost their homes, and nearly 250,000 small businesses had to close their doors for good. In response, Congress dramatically expanded CFTC's responsibilities in the Wall Street Reform and Consumer Protection Act, which we called the Dodd-Frank. I always agreed with our former colleague, Congressman Sam Farr of California, in categorizing the CFTC as a financial first responder. as Congress would never deprive first responders of the resources necessary to perform their duties. Unfortunately, CFTC has been held at the same $250 million funding level since 2015, which makes performing your duties as a financial first responder very difficult, especially when it comes to the daunting task of assuring the economic utility of the futures markets by one, encouraging their competitiveness and efficiency, two, ensuring their integrity, three, protecting market participants against manipulation, abusive trading practices, and fraud, and four, ensuring the financial integrity of the clearing process. I find this particularly ironic since CFTC has more than paid for itself. Between 2006 and 2014, actual fines collected against wrongdoers were more than 175% greater than the agency's budget during that entire period. I'd like to take this time to thank you for working across the aisle and reaching out not only to me as ranking member, but also to my colleagues on the subcommittee. We hear reports of departments and agencies being non-responsive to Congress and making the operation of the country appear to be a partisan circus. But I'm glad that the departments and agencies that are under our subcommittee have stayed above the fray, remaining professional, collaborative, and focused on their respective missions. Look forward to your testimony today.
All right, everyone, we are going to go on a brief break. So we're just going to show you a view of downtown Phoenix right now, and we'll be back with more news now later today. Of course, we'll break in if there's any breaking news. We just wanted to keep the stream on while we go on break so that you guys still have a chat room to chat with. All right, everyone, we're actually going to shut down the stream, but we will be back later this afternoon with more news now if anything breaks. Stay tuned.